Today I had a little kid that I saw in our rooms, and they had a really sore elbow. They'd come in after their dad had spun them around at the playground, and they just weren't using their arm much. I examined their arm, and I was pretty confident that they didn't have a fracture, but they just weren't moving their arm enough, and I think they had a pulled elbow. I know there's a specific manoeuvre we can do to fix it, but I can't remember what it is.
Yeah.
Do you remember what it is?
Yeah, so pulled elbow, really common diagnosis, very common in toddlers. I'm assuming the kid was a toddler.
Yeah, 3 years old.
Yeah, so common in that age range, essentially a dislocation of the radial head. And yes, there's a very specific elbow. Let's show everyone how to reduce the pulled elbow. We'll just get the camera there.
You borrow my arm.
Thank you. So essentially you want to, gently put some pressure on the radial head, and usually they've got their arms sort of pronated when they come in.
Yep.
And the key is to do it smoothly. In one smooth motion, you sort of pronate, and often that's enough to reduce it. But if not, you sort of pronate and flex the elbow all in one go, and you'll often just feel the radial head slip back into place.
Yep.
Job done. The kid will be moving his arm again. Mum will think you're the best doctor in the world. So if you want to see more videos on practical fracture management and orthopedic topics, I've done a whole series on orthopedic management on the GP Academy website, where I have a discussion with Mr. Jarrad Stevens, one of the orthopedic surgeons from the Victorian Bone and Joint Service. We talk about lots of different things, and there's a recent video about ankle fractures where we really delve into some of the minutiae around weight bearing, different types of weight bearing. Should they be non-weight bearing? Weight bearing is tolerated, what all that means, as well as some stuff on when to refer patients for removal of metal. So we often focus on the big things, the diagnosis, the referral to the orthopedic surgeon, and we forget these little minutiae. So these videos that I've recorded with Jarrad are really practical advice for GPs, and I'd encourage all of my colleagues to get out there and have a look on the GP Academy website. Thanks very much. Thanks, Laura.
Bye.